The OCTA Research Group has warned of the rising COVID-19 infections in Metro Manila over the past week. To give us more details about this alarming trend, OCTA Research Fellow Professor Guido David is with us on the phone. Sir Guido, good evening.
Hi, good evening, Riza.
Professor, what's your reaction to over 8,000 reported new COVID-19 infections recorded today?
Well, obviously, we don't like that. We don't like to see big numbers. We were hoping that the numbers would decline, but this is actually sort of part of the projection that we had last week when we said the cases would likely hit more than 8,000 cases. It just occurred in a delayed manner, but this was actually part of our projections.
Sir, what does the latest trend show regarding the COVID-19 cases in Metro Manila and the rest of the country?
Yeah, in Metro Manila, the reproduction number is 1.44 already, and it's increasing. It's starting to accelerate. That is very concerning, of course. The positivity rate has already increased to 9%, and I think this last week it was at 6%. So rapidly increasing positivity rate is very, very concerning. As far as other indicators are concerned, the daily attack rate is still, I believe it's still in moderate, but it's going up, so it will not be moderate soon. And also the healthcare utilization is still safe, but again, these are lagging indicators, meaning that they don't increase as quickly as the caseload or the reproduction number. Now, in other areas, we know that also in Cavite, there's an increase in cases. In Bulacan, there's an increase in cases. In Ilocos Norte, of course, increase in cases. Cebu, definitely a surge going on there, and Cagayan de Oro.
Sir, how about hospital bed occupancy? Do we have an update? Are we reaching alarming levels in that category?
Not yet in the NCR. In some regions, yes, hospital beds are at high occupancy, but in the NCR, it's still, I believe it's somewhere around 46% or so. It is increasing, but it's not yet in critical level.
Sir, in OCTA's view, will the GCQ with heightened restrictions that's being implemented, then the ECQ, be enough to address the rise in cases?
We hope so. It was able to address the rise in cases last March and also last year in August. August, we had a 2-week lockdown, and it was sufficient to decrease the number of cases because the number of cases then was still less than 2,000. Last March, we had a 7-week lockdown. It decreased the number of cases after 7 weeks. But we had the lockdown at 5,000 cases. So right now, we're banging on the early intervention. We're averaging about 1,150 cases per day in the NCR. That's increasing. But hopefully, because of the early ECQ, this will not increase much past 2,000 cases per day in NCR. 2,500, sorry.
Sir, aside from Metro Manila, are there other COVID-19 hotspots in the country?
Yes, these are Cebu City, Mandaue, Lapu-Lapu, Cagayan de Oro, Lawag, Ilocos Norte is still a hot spot, and also Bacoor and Imus.
Finally, sir, how are the projections looking like by the end of August?
Well, if we didn't have the ECQ, we might reach 8,000 or more cases per day just in the NCR. Right now, we're at 8,000 cases nationally, but just in the NCR, we might reach 8,000 per day if we don't have the ECQ. But right now, what we're seeing is that we're hoping that it will decrease starting, not immediately after the ECQ, but sometime before the end of August. It will be controlled at below 2,500 cases.
Certainly hope for the same thing. Thank you very much. That is, of course, OCTA Research Fellow, Professor Guido David.